Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
We trust them with our lives, yet many of us find it difficult to have open, honest, and frank conversations with our doctors. With me today is Dr. Thomas Royer. With more than 45 years of healthcare experience as a clinician, clinical leader, physician executive, and health system CEO, he's here to help us become courageous consumers of healthcare services. I'm Lisa Sather, and this is Healthy Living for Life. Stay tuned. One of the many hats today's guest has worn is that of a clinician. Welcome, Dr. Royer.
Thank you. It's a pleasure to be here, Lisa.
Thank you. Thank you for joining us. So in preparation for your visit today, we asked a random group of consumers in our area to send in questions they felt that would help them become courageous consumers of healthcare. So are you ready?
I am ready, and I would just add this is such a pertinent topic for this time, and I would stress two reasons, Lisa,
Yes.
to your audience. Number one, a study was just reported out of Johns Hopkins by Dr. McCary in the last year, which indicated that medical errors are the third leading cause of death in the United States behind heart disease and cancer. I mean, think about that. But on the positive side, actually, the value equation, which I will explain briefly, is actually driving healthcare in this last year and a half, not only driving healthcare from the standpoint of quality, but also because of payment. And the value equation says we must do everything to improve quality and safety, patient satisfaction, and that's the numerator, and underneath is we need to stabilize or reduce cost. So that's forcing healthcare to be patient-centric versus hospital-centric or provider-centric. So indeed, the patient has a much more important role than they've had in the past. So this is so timely, and thanks for having me.
Oh, perfect. Great. So first question. There's a fear among patients that if they disagree with their doctor or challenge their recommendations, that they may risk making their doctor angry. So can you explain to us what's the best way for a patient to have this conversation with their physician?
Well, first of all, I would say if they make their doctor angry and he gets very or she gets very angry, probably it's not the right doctor in the long term. But to begin, certainly there will be times when you need to have that difficult discussion. I would say, first of all, be very professional. Explain why you're taking the position you're taking, why you're having a different opinion. Hopefully provide data for why you believe something is different, whether you've heard it, whether you've read it, and just in a calm way, ask the physician for their response to that, and just wait and see what they say. I would say that good physicians will not find that to be problematic.
Great information. So along those same lines, when patients want a second opinion, for example, they fear they may be questioning their doctor's judgment again. And what's the best way to talk to your doctor about getting a second opinion? And second part to that is, does that put a black mark on the patient-doctor relationship if I say, hey, I need a second opinion here?
Yeah. Well, unfortunately, I have worked with many physicians over the years, some of whom resented when patients asked them for a second opinion. And I would say again what I said on the first answer, they're not the right physicians for you in the long term. I think clearly you need to be able to ask for a second opinion, particularly if your case is complicated, or again, you are seeing data which might say there might be a better approach, or there could be an alternative approach that you want to look at. So again, just be open and honest and say, I would like a second opinion. Good physicians will encourage that. I have all my career. If I was telling a patient, making recommendations, telling them what they needed to do, and they looked pensive or somewhat anxious, I would say, you know, this is a big step for you. Go get a second opinion and let's see what that says. And let's try together then with that information, another voice, make the best decision. So again, if the doctor resents it, too bad, seek another physician. But don't avoid asking for a second opinion if you really believe it's necessary.
That's great advice. It makes complete sense. So another question here from our viewers. So let's say I'm getting a surgical consult for a heart condition.
Yes.
Are there things I should do ahead of time to make sure I'm seeing the most capable surgeon for the procedure?
Probably that question is even maybe more significant than the first two, because clearly a surgical procedure has more significant potential negative outcomes than a medical diagnosis. Not always the case, but certainly. There are two ways, Lisa, for today that people can actually get documented information. The first is on health grades, which you can find on the internet. The second is Yelp. It's a free service, and I am discovering now 90% of the people who call me for medical advice still, usually other colleagues about their parents, have already looked on Yelp. And you will see not only 5, 4, 3, or 2 stars, but you'll also see written recommendations or concerns written by people who have accessed these services. However, once you're talking to the surgeon, it's very important to say, how many of these procedures have you done? Number 2, what is your mortality rate? Do you have any deaths? What is your morbidity? Do you have any complications? What are your positive outcomes? What's the return to work rate? Do you ever have to bring back people for another surgery, for a complication? What's your infection rate? Good surgeons will answer those questions for you.
Wonderful. Well, thank you. We have about just a minute left before we have to take a quick break, but just quickly, if somebody wants to dismiss their doctor, do you have some advice that you would give them on how to do that?
Yes, I think merely calling the office staff and just say, for obvious reasons or for numerous reasons, and you don't have to explain them, I have decided to change physicians. What I would like would be a complete copy of my medical record, and I would like that both electronically, if you have it, as well as in a written form. And I would also like those records not only given to me, but to be sent to the physician, and I'll give you his name and address when I get it.
Great, thank you so much. We're going to take a quick break, and up next, he'll answer more questions from our viewers. Please stay tuned. Welcome back. We're joined by Dr. Royer, who's here to answer questions to help you at home become courageous consumers of healthcare. Welcome back again.
Thank you.
Yes. So, Dr. Royer, here is another two-part question from one of our viewers. My GP, or general practitioner, sends me to a specialist, and it's apparent the specialist has not looked at my file prior to sitting down with me. As he begins to visit with me, it's also obvious that my file doesn't contain my current information. First, can you address if it's normal for the specialist not to have looked at my file prior to sitting down with me? And next, what could I have done to make sure the specialist had received current information?
Well, first of all, for every referral from a general practitioner or your primary care, it could be a nurse practitioner, you need to make sure, if they're referring you, that you tell them you want your records sent to that referring physician. Secondly, I would like to remind all your viewers, they own their medical record, so they can have access to it. So indeed, a good idea, which I am now pushing, is that when you're going to a referral, you ask for a copy of the medical record also, so you have it. And because many of the studies are now in electronic form, such as an MRI, ask for it electronically on a disc as well as the written document, and you take it to the physician. Now, if you get there and they haven't read it and you believe it's significant, I think there's two possibilities. Could you please take time to read this while we're sitting here, and I can answer any questions for you, which they may not want to do, but hopefully they would. But in worst case, you can say, I would appreciate if you would study this record completely, and then I will reschedule my appointment after you have done so.
That's great advice. All right.
They may not like it, Lisa,
Yes.
but that's
Hey.
what I think you should do. You can't make a diagnosis without reviewing past history. And with these complicated cases, the past history can be enormous.
Makes complete sense. All right, so another question comes from someone concerned about consistently being kept waiting.
Oh.
When they come in for a scheduled appointment, I believe this has happened to all of us at one time or another. They add that it's not just a 10 or 15 minute wait, but potentially an hour wait. This person wants to know if there's a tactful way to convey that her time is just as valuable, and then she really can't afford to wait that
Yes.
long.
Clearly, if the person has an appointment that they need to make within a period of time, and I would think anyone reasonably would say, we're probably going to be at the doctor's office for an hour. So you might schedule something for an hour and a half or 2 hours from then. I think it's always good to go up to the reception desk when you sign in and say, I do have an appointment outside of this office at an hour and a half, and I hope that I will be able to do that. Put it on the line. Give them notice. Secondly, I think it's important if it's delayed and you're going back and delayed, let the receptionist know, let the nurse know on the way back to the exam room. I think I've been held probably a little too long today. I wish you could be more efficient. I think it's appropriate also to say that to the physician. You know, I'm glad I've gotten to see you today, but it might have been more helpful if you speeded it up. Now, because patient satisfaction is going to be one of the criteria in the value equation, most offices now are doing patient satisfaction surveys. So I tell every patient, fill out that survey promptly in writing if they give it to you. If it's done over the phone, do it also. Because I will tell you, Lisa, that's how the star rating is being determined on Health Grades and Yelp.
Thank you. All right, so this is a common question we've received many times. Many patients are embarrassed to ask their doctor to wash their hands before they examine the patient. What's the best way to ask my doctor to wash his or her hands before he examines me?
Okay. This is a little complex because today most of the hand sterilization is not done through washing, but it's by using one of those dispensers that have the liquid in it. So the first thing you need to do, unfortunately, when you go into the room is to see if there's a hand dispenser outside, because they often put that on before they come in the room. If indeed you don't see that and they don't have a dispenser in the room that they don't use when they come in, then if they don't have a sink, and many of exam rooms, the ones I've helped design in my career, I've always said there needs to be a sink in the room. And in order to make my patients comfortable, I've always washed my hands in front of them. So if the patient is not assured that they've used liquid or they've used water, it is perfectly all right to say, would you mind washing your hands? I just have a real concern about an infectious process, and maybe I'm over concerned. I think that always helps, makes them a little, less to be confrontational, but I really would appreciate if you do hand washing. We know, it's been proven by research data, that hand washing by providers is the single cause of a decrease in the infection rate. Far above antibiotics, Lisa.
And my physician should be comfortable with me asking them that question.
Absolutely. Again, I would tell you, the courageous patient has to be the patient of today. It can't be the patient of yesterday who thought I was a god and walked on water and they were afraid to ask me questions.
Absolutely.
Because they're going to drive healthcare. It's now going to be patient-centric. And I would have to say, it's a very basic statement. If the physician gets offended, you have the wrong physician. It's that simple.
Thank you. That is something that I think everybody can benefit from hearing. So that's.
Don't feel badly. There are lots of doctors out there. And the best way to get a recommendation besides Yelp and Health Grades is talk to a friend or a neighbor, a personal recommendation of this was a great person.
Absolutely.
And if you are upset with your physician, ask in the neighborhood who they go to. Who would they recommend? Wonderful.
Heading for surgery? You won't want to miss what's coming up after the break. Stay with us. Welcome back. With me is Dr. Royer talking to us today about how to become a courageous healthcare consumer. Welcome back again.
It's a pleasure.
Yes. So my next question comes from a person who lives in a rural community in eastern Montana. He's been referred to a specialist who is a 4-hour drive from where he lives. He tells us that no matter how hard he tries, he can't get past what he perceives to be a condescending demeanor from the provider. He adds, He's brusque, he talks down to me when I try to explain my symptoms, and instead of listening to me describe my symptoms, he interrupts me saying I'm not giving the correct anatomical language. How do I work with someone like this, Dr. Royer, or can I? He's the closest specialist from where I live.
This is a good question because it has played out in reality, and I will tell you it's a little challenging, but listen carefully. I think it depends on the severity of what this patient has and the qualifications of the specialist. In a rural area, for someone that has to travel 4 hours, I would say there's probably not a lot of those specialists around. So if this specialist is providing high quality care, it may be necessary for this person to just overlook that abruptness and that briskness and just sort of ignore it and opting for, I want to go to this person because there's no other specialist around that will have such good outcomes. Hopefully, this specialist will have an assistant, perhaps a nurse or a fellow or a resident, that they can interact for what I call the softer side of the healthcare delivery process and tolerate this person. I have a prime example of a neurosurgeon that was on my staff who actually had that brusqueness, and he was a little impatient, but I will tell you, he could have cut off my head and put it back on. So I would have gone to him and let him be a little arrogant, and I would have just had to tolerate it, because at the end of the day, it is the clinical quality and not the personality. I hope that's helpful.
Very good, thank you. Okay, this is kind of a common one, Dr. Rory. This question is from a viewer who really is not crazy about taking medications. Her doctor wants to write her a prescription for a blood pressure medicine, and she wonders if she should be asking questions before agreeing to take it.
Certainly medications, I would say, these medical errors probably contributes for 25 to 30% of the medications that you don't have or have severe toxic side effects. You know, as a pharmacist, Lisa, there is no safe medication.
Yes.
So indeed, before you take a medication, I think you need to ask, do I really need it? Is this the safest one for me to take? And if I take it, what are the side effects that I should be looking for? And again, very great today, you can look on the internet, look up any medication, and it gives toxic side effects. And I'm going to give you a personal example of these toxic side effects. My wife had to have a major surgical procedure and was put on a very, very broad spectrum but very harsh antibiotic. She had a seizure as a result of this. And as my doctor's son was running down the hall to see her, the pharmacist walked beside him and said, your mother should have never been on this medication, Chris. It should never be given to someone older than 65. Another complication from changing the cholesterol drug. Some of them cause rash. So medication is a significant issue, and don't take it unless you're satisfied and if you know what side effects to look for.
Thank you. So, another question, when a doctor gives a patient a diagnosis and the patient is still sick, is there anything for the patient to do from there?
I think clearly it is very appropriate to ask the physician, what else could be wrong with me? A physician always has a primary diagnosis, but we're all trained to have differential diagnosis. If this one is not right, what is it? For instance, when I operated on appendicitis, and it wasn't appendicitis, I didn't close the patient. I looked for a Meckel's diverticulum or a ruptured duodenal or ulcer. So again, what's on your differential list? Are you going to work down those, or then again, based on that answer, would be a good time to say, should I be getting a second opinion to see if we can collaborate or at least get another idea? Always a second set of eyes. A good physician knows what they know, but more importantly, they know what they don't know. And they're always comfortable in getting another opinion.
Good. All right, I think this is valuable, especially given our earlier conversation. So we hear a lot about medication errors in hospitals, and errors occur when patient receives the wrong medication or when he or she receives the right medication at potentially the wrong dose or the wrong duration or things like that. So how can patients minimize or eliminate the risk of receiving the incorrect medication?
Well, I would say this is an issue both in the inpatient and outpatient area, Lisa, particularly with elderly patients who are on multiple medications. Number one, in the hospital, ask everyone who's coming in, what medicine are you giving me? Is it the same medicine I've been on? Is it the same dosage I've been on? It's been changed. Why has it been changed? And is the doctor aware the last time I got it, I might have felt a little woozy? I mean, that real-time communication. For outpatient, I always tell the patients, when you need your prescription refilled, always keep at least one pill. Because when you get it filled, you always look and say, is that pill the same as this pill? And so you're always pretty sure that you're getting that continuity. But I will tell you, the pharmacist is a great resource. Yes. And I think it's important when you go to get a prescription filled that you say to the pharmacist, again, is this the right prescription? And another big question, you know my other medications I'm on. If you don't, give them to the pharmacist and they can help you understand, are you going to have any cross reactions?
Absolutely, yes. Thank you. So we have time for just one quick question and maybe 30 seconds, Dr. Royer. My mother was in the hospital. This is a question we got. I thought her needs weren't being met. What should I have done as her advocate?
I think you need to be able to say these are the needs that are not being met. You need to identify what needs to be corrected to get those done. See if the staff is taking accountability for it. And if that's not the case and you're not satisfied, ask them to arrange for a transfer.
And go up the chain of command if you need to, right?
Absolutely. Nurse, nursing supervisor, manager of the area, and then guess what? I need to see the CEO.
Perfect. Thank you so much. With that, I want to thank Dr. Royer. I think you've helped us all become courageous consumers today, so thank you so much. And showing us how to get off the sidelines and get into the game, right?
Absolutely.
Until next week, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.